Thank you for joining us for Turn the Page to Health, Diabetes Education Opportunities for All Coloradans with Kristen Hinkle, a certified health coach with the Adams County Health Department. And as a note, this content is for all Coloradans, no matter where you are in the state, although this is based out of the Adams County Health Department. This is virtual too. My name is Christy Moran. My pronouns are she, ella, and I am the Adult Library Services Senior Consultant for the Colorado State Library, or as I like to say, a librarian for Colorado's library folks. Today's event will be recorded. It's being recorded now, and all registrants will receive an email with a link to the recording and any resources shared, including Kristen's contact information, which will be key. At the end of this session and in a follow-up email, I'll be sharing a link to a survey. The State Library uses this survey to inform our work and to report on the value of our programming. It is especially nowadays essential that you tell me what you need, but also that you tell us how you value the work that we do for you as your librarians. One of Kristen's team members is actually here on this call with us, and they'll be able to answer questions via chat if anything comes up, and Kristen will also have time at the end to do that. So now I'm turning it over to Kristen. Welcome, Kristen. Tell us what you know.
Thank you so much for having me. Thank you for all for coming. We appreciate your time. I wanted to call out the few team members that are on this call as well. Elena O'Hare will be checking the chat, so if you have any questions, she's happy to answer them. Maritza Orozco Reyes is also on the call, and she's happy to answer questions, and Carrie Howard as well. So we are all happy and willing to answer questions. Let me share my screen and we can get started. All right. So as Christy mentioned, we are the Diabetes Education and Prevention Team, and we are housed in the Adams County Health Department. However, we're funded through the Colorado Department of Public Health and Environment using tobacco funds, which allows us to provide programming to all Coloradans, not just those housed in Adams County. We offer 3 different programs at the moment, and we're always looking to add more. Currently, we have a diabetes prevention program, a diabetes self-empowerment program, and then finally, we just added a heart health program. It does require an initial in-person meeting, so I'm not going to cover it in this presentation, but if you're interested in more information about that, I'm happy to share it with you. Before we get started talking about our programs, I just thought I'd make sure that we all had a good understanding of what diabetes is. So diabetes is a disease in which the body either does not make enough insulin or it does not use it properly. And sometimes it's a case of both things going on at the same time. Insulin is a hormone that helps our body use the blood sugar, or I'm sorry, is a hormone that helps our body use the glucose that we get from eating carbohydrates, and it's a fuel source for our cells. Insulin essentially is that key that unlocks the cell membrane and allows that glucose to enter. So when that doesn't happen, it creates all kinds of problems. There are 2 different types of diabetes. Type 1 is an autoimmune disease. We have research going on right now to decipher the environmental causes, but at the moment we don't have a way to prevent type 1 diabetes. Type 2 diabetes does have a genetic component, but it's mostly what we found is that lifestyle changes can have a big impact on someone's ability to prevent type 2 diabetes. And so that's what our programs focus on. And the combined effect of having too much sugar in your blood, as well as your cell's inability to use that energy effectively, can lead to these kinds of the damages that we can see in your body, right? So damage to heart and blood vessels, nerves, kidneys, eyes, feet, gums, and skin. So some pretty potentially big long-term impacts. There are multiple risk factors for type 2 diabetes. Some of them we have control over, some of them we don't, right? Having a family history of diabetes, not something we have control over. But our food choices and our physical activity habits, we have some more control over. So that's what we focus on in our prevention program. Before we talk about our programs, I did want to give you some numbers. So over 37 million American adults have already been diagnosed with diabetes. And 96 million Americans currently qualify for a pre-diabetes diagnosis, but over 80% of them are unaware, which is kind of scary to think that you're walking around with a ticking time bomb. In Colorado, 1 in 3 Coloradans are estimated to be at risk for developing type 2 diabetes in the next 6 years. And so that's what one of the things our team is really focused on is reducing those numbers. And we do that through our Journey to Wellness program. This is also known as the National Diabetes Prevention Program, and it's run, the curriculum was developed by the Centers for Disease Control in about 2012. We just recently had an upgrade to our curriculum in 2021, and it is a nationwide program. So it's throughout the 50 states. It's a year-long proven lifestyle change program, and it's for people with a pre-diabetes diagnosis, for anyone who scores 5 or more on a diabetes risk test, or for anyone who's had gestational diabetes. We cover 26 modules in 24 classes over 52 weeks, which is why we like to say it's 24 hours to change your life. The key topics that we cover in the National Diabetes Prevention Program include physical activity, nutrition and meal planning, behavior change, stress management, weight management, and support and motivation. And essentially all topics are touched on repeatedly throughout the year. So for example, we introduce physical activity the second session. And then we return to it multiple times throughout the year. We talk about challenges for fitting it in, how to build on your successes as you continue to build that out throughout the year. The program's goal for each participant is 150 minutes of moderate physical activity per week. We don't ask them to jump in and do that right away. We encourage them to build it over time using small steps. Same thing with nutrition and meal planning. We talk about the importance of having balanced meals. We talk about ways to eat out at restaurants or at social events. We talk about healthy swaps that you can make, right? And so we are constantly threading that information throughout each module. When it comes to behavior change, we talk about anticipating challenges, effective strategies for goal setting, what to do when you fall off the wagon. Stress management, we cover how impactful that can be on your overall health and ways to manage that. And then weight management is really threaded again throughout the curriculum, right? By talking about physical inactivity, by talking about nutrition, all of those things. The curriculum does set a goal for each participant that's at an unhealthy BMI. They recommend that your goal be to lose between 4 and 5% of your starting weight. For someone that's 200 pounds, that's about 8 to 10 pounds, right? So we're not looking for 50-pound weight loss. We're looking for small and sustainable steps there. And then the support and motivation piece really comes from both the coach and the group. The group is really an essential part of this program, right? Making sure that people are well supported, that they're getting ideas from more than one source. Yeah, we love our groups. So why National Diabetes Prevention Program? The Centers of Disease Control have continued to develop and support this curriculum. They also have continued to research it since its implementation. And they found that participants can cut their risk for developing type 2 diabetes by about 58% by participating in this program. It's actually higher for those over the age of 60, 71% reduction in risk there. And the American Diabetes Association also recognizes the National Diabetes Prevention Program as an effective intervention for diabetes prevention. And when you're talking about for an individual participant, Again, there's that reduction in the risk of type 2 diabetes, but they leave with improved nutrition, improved physical activity habits. They have these healthy behavior skills, and really we find that they enjoy long-term health benefits. So I'm going to pause there for a second. Are there any questions I should know about? Anyone have anything I might have missed? Okay, I'll keep going. All right, so our next program is our Diabetes Self-Empowerment Program. And what that actually stands for, or more commonly known is the Diabetes Self-Management Education and Support Program. And with this program, our goal is to empower individuals that either have a diabetes diagnosis or are supporting someone's care that has a diabetes diagnosis. Our goal is to empower them to make informed decisions about their health. This program is 8 hours of education instead of that 24 hours of education, and we do things a little bit differently here. So if they're meeting virtually, it's 8 hours. I'm sorry, it's 8 one-hour sessions, typically met weekly. And if you are meeting in person, then we do 4 sessions of 2 hours a piece, and typically those are weekly as well. We use an interactive curriculum called the Healthy Interactions. This background is actually an example of that. And it discusses everything from, let me change my slide, understanding diabetes, blood sugar monitoring, nutrition and meal planning, physical activity, medication management, and emotional support, right? So we want to make sure that the individuals participating in this program have a lot of information about the different types of diabetes, the causes of diabetes, why it's important to manage diabetes, right? We want them to have the skills to know the best way for them to monitor their own blood sugar, and how to interpret those results. We want them to have a good understanding of balanced nutrition, carb counting, ways they can make healthy impacts on their choices. Same thing with physical activity. We want to make sure they have as much information about medication management so they can understand their options there. And also, we want to help them navigate the emotional challenges, right? It's hard to have a diagnosis that is so significant in terms of impacts on your health. So why DSMES, or Diabetes Self-Management and Education and Support? This again is an evidence-based program that's been proven effective and supported by multiple organizations, including the Association of Diabetes Care and Education Specialists, the American Diabetes Association. And then as a note, the education materials in this program are based on the ADA's standards of care guidelines that changes, it's updated annually. So currently it's the 2025 standards. At a participant level, they can expect to have better blood sugar control, meaning that their A1C levels tend to be lower. They can enjoy fewer diabetes-related health issues, gain greater confidence in managing their overall health and health-related choices, and just in general, they enjoy an improved quality of life. Any questions about our diabetes self-management program? So why Adams County, right? Why would you encourage your community members to join our programs? Our virtual classes mean that we can offer these programs to anyone in the state of Colorado, right? So location and transportation are not a barrier here. We also have a diverse group of educators from a variety of backgrounds, and we're able to provide these programs in both English and Spanish. We are also prepared to help people navigate not only those transportation issues, but any issues related to social determinants of health. So we continually work to maintain our resources, right? So that if someone's having a housing issue, we might not be able to solve it for them, but we can point them down the road to hopefully solving that. Same thing with food insecurity or mental health issues. So we support our participants in as many ways as we can with the resources that we have available. Again, both programs are evidence-based, proven with research, and trusted by medical professionals. One of my favorite things about our programs is that we don't offer prescriptive solutions. We really work to meet each individual where they're at and make sure that they have the tools to make healthy decisions that are reflective of their daily realities. And then our team is a bunch of nerds. I think they'll all agree with me. And we really enjoy making sure that we're up to date on the latest and greatest information and research when it comes to health practices and diabetes management. So we're committed to constantly learning. And we're fortunate that the Adams County management is committed to supporting our efforts as well. Finally, how to find our programs. One thing to note is that our programs are only available to Coloradans over the age of 18. We'd love to start serving families at some point, but our funding at this point is only for those adults over the age of 18. And you can find our current class schedules for either program, Diabetes Self-Empowerment or Journey to Wellness, the prevention program. They each have individual pages, and that's where their class schedules are listed. Or you can use this QR code, which will take you to our main diabetes education page, where both of these web pages are also linked. So I'll give you a minute to take if you need to scan that code. And then if you have any questions or need more information from me, here's my contact information. I'm happy to provide additional program information, promotional resources or materials, anything you might need to get the word out about our programs to your community members. That's all I have.
Hey, Kristen, in the chat, you have one question regarding the prevention program. What are the criteria to qualify? What is the risk test you referred to? Which I'll put that in the chat right now.
Perfect. Thank you, Elena. Yes, Elena can throw that risk test in the chat. And I also have a page of resources if you're interested that has the link as well. That goes through a series of questions that basically takes you through the risk factors, right? Do you have a family member who's had diabetes? Have you had gestational diabetes? What is your age? What is your current weight? How active are you physically? And maybe blood pressure off the top of my head. So that risk test is one way to qualify. Another way is through blood work, right? So A1C, the names of the other tests are blanking. I'm blanking on them at the moment, but blood work through your doctor would be how you get that prediabetes diagnosis. Oh, Christy, you're muted.
There is a question in the chat. Can you please explain what A1C is?
Absolutely. A1C is a blood test that measures your average blood sugar. Now words are failing from my brain, but essentially measures your average blood sugar over the past 3 months. So it gives us a picture of what your body's been doing over the past 3 months. Did that answer?
I think so. I do. We met at a cross-sector collaborative summit here in Colorado, and there were a lot of people in different industries, right? Libraries were among them, but also a bunch of different public health resources and departments, et cetera, et cetera, et cetera. And one of the things that we talked about was how do we get something like this that is public facing? So the program itself, right? The education program itself is for the public. Like it is, I mean, like, yeah, I'm a member of the public, but also it's not really for like library staff, so to speak. It's kind of how do we get this awesome education program out into our communities? So you mentioned that it was digital. But our libraries are all over, right? We have Montrose, we have Greeley, and we have Brighton among us right now. So how do you see like a library, say in Montrose, engaging with you? Like how does Montrose, like Montrose neighbor, get this program from you?
Oh, great question. So what we would love is if you would be, if any libraries would be willing to share, right, a newsletter or something like that. Where we have information like linking to our page to register for classes. And then we have anyone in Colorado can register for our class and then attend a virtual session at any point. And if they're within the Denver metro area, we do have two upcoming in-person classes. So if they were able to go to either Thornton or North Glen, we're going to have classes starting in the fall.
Tanya has asked a question in the chat about fees. So is there a fee for classes or insurance coverage? Like what is the fee structure and or coverage required in order to have this?
Great question, and I should have put that in my presentation. I apologize for missing that. Currently, it is at no cost to participants. We are charged with finding sustainable ways to maintain our program beyond grant funding. So we are looking at charging insurances or Medicaid, but we currently are offering completely free, and will do when we move to that model. If we move to that model, we'll be committed to making sure everyone has access to our programs.
Thank you very much. Because as you know, libraries, although we're not free, right? Tax funded, tax supported, public support, are open to all, and everything that we have is of no immediate cost. That is crucial. Mallory has a question. Should we reach out directly, meaning to you, Kristen, should we reach out directly for promotional materials, or is there something readily available on the website? And that's a really important question for all of us. And if you have anything, by the way, that Mallory is asking for, like any kind of images or digital kind of facing and links, get that to me because I'll get it to all of them. But please answer that for Mallory.
Absolutely. I do have all sorts of resources. I'm happy to send them over to you as soon as we are done with this presentation. We don't have anything readily available on our website, but I do have images, newsletter wording, flyers, and even some additional links if anyone's interested.
Thank you very much. And Elena has put in the chat a link to, again, it's the Adams County Health Department page, but Mallory, you are able to access all of that. And I will make sure that not just the folks who registered for this, but that others get this too. So this is really critical information.
Thank you so much.
Yeah. Carrie, you have your hand raised, but you
Carrie,
also
you're
are on
muted.
mute. So
Sorry, I was searching for through my emails for the details and I couldn't find it. And possibly this will strike a chord with some of you. I know in the coming week or couple of weeks, we have a meeting with the state health department and diabetes prevention and diabetes providers across the state. And someone from the libraries is going to be talking about the telehealth opportunities with libraries. So I just wanted to also plant the seed. If any of the library systems were interested in hosting group classes or being host sites for participants to join via the internet for folks who don't have access in their homes, we'd love to chat about that opportunity as well.
thank you very much for mentioning that. So this is probably Kieran Hickson, who's the small and rural libraries consultant, is my counterpart. I work with Kieran all the time, and I put the telehealth pilot program link in there, but it's now in the second year, so the pilot was already. But please keep in mind that very much like, and I'm going to drop the name of a totally different thing, very much like Senior Planet, we are able to, in our locations, if necessary, and even kind of just if wanted, not necessary, we can broadcast and share a lot of the critical information. That is like, we could virtual stream it, right? Like have a streaming party. I know it's like not fun for diabetes, but we could totally do that, right? So absolutely. Thank you, Carrie, for mentioning that. Does anyone have any other particular questions to ask? Because I always have questions for other libraries, but if you've got a question, please ask it in the chat. Okay. So we mentioned that we have telehealth hubs in our libraries. We also have, a lot of our libraries maybe aren't the telehealth libraries. That's super okay because we have like laptops, we have like study rooms. So my question for you, would these classes be live synchronous so that like we would know that we would have to host, say, a study room or a quiet space for participants? Is that, or is it just kind of asynchronous? You just sign up to take whatever class whenever you want. A member of the public, I mean.
Yes, thank you. They are synchronous, and we do publish our schedules. So when we commit to a class, we commit to the entire 12 months. So we have specific dates already set up once we have a class on our schedule. So we could easily share that with the library so that you could plan around that.
Thank you. And those classes, now we just, Carrie's idea, right? Like if we had, say, 4 people in our community, right? 4 people in Greeley, they were signed up and they would rather do it not alone. Would we be able to have all 4 of them together in a room and live stream it? Or is this privacy has to be one person at a kind of?
I think it would be fantastic. In fact, right now I have a class where a brother and a sister and a wife are all in the same room, right? And I think it adds to the effect, right? You want that group support and connection. So I think we'd love that.
Excellent. Thank you very much. So I don't see any more questions from the chat or in the chat. And I wanted to make sure that Kristen had lots of time to answer questions in the event that everyone who registered showed up, because as usual. So I will, if we don't have any more questions in the chat, I think we can give people about half an hour of their day back. I won't tell anyone that you are finished half an hour early. I'm going to close the recording. Remember, I'm going to email everyone who registered with the content, with all of those, if Kristen, all of those like images and things like that, any links that we need, any information available. Remember that this is a program for the people who live in our communities, but also, like, spoiler, we live in our communities too. So if it is something that your workplace you feel is something that you want to share with the folks that you work with, this is also something that would benefit us, right? Please make sure to check your emails and reach out to me or anyone on this call, Kristen, as well, if you have any questions in the future. I'm going to pause and stop this recording. Thank you.